signs related to the pregnancy. If you are going to check the pregnancy in the cow or the buffalo by the rectal palpation, the standard method was just to hold the landmark and then you can check for the fixation of cervix. How? You just have to, you can say, pull back the cervix toward your side. That is known as retraction of the reproductive tract. If it is difficult, it means that the animal is having the sign of fixation of cervix. If the cervix is fixed, it means that there is some kind of the weight inside the uterus. First thing that should come in your mind with history of any stress, the animal might be pregnant. But we have to then again confirm. And the fixation of cervix will be very clear at minimum 2.5 months or will be more clear at 3rd month of pregnancy. This one is retraction of the reproductive tract. If it is difficult, this is the supportive sign. It means that the animal is having fixation of cervix. Then we will go toward the rolling of the uterus. That is just like that. So if the rolling of the uterus is difficult, it means that again the first thing with history of any stress should come in your mind. Maybe the animal is pregnant, but still we have to confirm what are the contents inside the uterus by looking for the confirmatory sign. Or then you can go for the palpation of the ovaries. So palpation of the corpus luteum is again the supporting sign of pregnancy. If you have palpated the corpus luteum, then you have to confirm that either there is any out of the 4 positive signs, that was the palpation of the placentum, palpation of the fetus, palpation of the fetal membranes, palpation of the amniotic vesicle. If you have observed any out of these 4 signs along with the palpation of the CL, it means that animal is pregnant. Okay. Then you can look for this from supporting signs. You can look for the resilience or fluctuation or vibrant motion in the uterine wall, that is due to the amniotic fluid. Plus, with the passage of time, advanced pregnancy, the uterine wall you somewhat feel like thin. Okay, so you can feel by just tapping the uterine wall if there is any kind of the movement of the fluid inside the uterus, or you can feel the thinning of the uterine wall. That is again the supporting sign. You have to confirm. Okay, then you can look for the free mitus. That is known as the palpation of the you can say feeling of the pulse inside the middle uterine artery. The middle uterine artery is the major artery in the broad ligament that is going to supply the blood to the uterus when it is pregnant. Okay, the supply of the blood will be more pronounced. Usually it is you can say used to supply the blood to the uterus. But the pulse that we can feel or the change in the size of the artery, that is known as hypertrophy, it is related with the pregnancy of minimum at least 3 months. Okay, so this is the, you can say, middle uterine artery, the very larger and prominent artery inside the broad ligament. This is the middle uterine artery. Okay, so this is the right middle uterine artery. Then you can feel over here the left middle uterine artery. This is the left middle uterine artery. Okay, this is the left middle uterine artery. You can feel over here. Okay, this one, the moving structure. This is the left middle uterine artery. Then you have some branches, caudal branches of the ovarian artery and the branches of the, but the major artery over in the broad ligament is the middle uterine artery. So usually you know that the track of the cow or the buffalo is used to look like that. Then the pelvic cavity is suspended with the help of the broad ligament that is being attached with the pelvic walls. So whenever you have to look for the middle uterine artery, you have to move your hand either toward the left side or toward the right side to look for the pelvic walls. So along the shaft of the ileum, you can find the middle uterine artery, the change in the diameter, the feeling of the turbulent blood flow, that is known as free mitus. And with the passage of time, with the advanced pregnancy of 5th or 6th month, the uterus will be more toward the abdominal cavity. Then someone can just find the middle uterine artery over the wing of the ileum. Then you can have to pass your hand further forward. Okay, these were all about the, you can say, the supporting sign of pregnancy. And plus, if you look for the asymmetry, if it is having no sign related to the pregnancy inside the larger wall, it means that this asymmetry can be due to the previous history. Okay, so now moving toward the confirmatory signs that one can look in the uterine horns. There are 4 confirmatory signs of pregnancy. One can find by the palpation of the amniotic vesicle, the palpation of the fetal membranes, that is known as membrane slip test, and the palpation of the placentums, and the palpation of the fetus. These are the 4 signs. Okay, so you have to look for all these signs by palpating the uterine horns. This is just a method how you can palpate the amniotic vesicle. You know that amniotic vesicle and fetal membranes are the early sign of pregnancy. By the very first month of pregnancy diagnosis by the rectal palpation, one can look for the amniotic vesicle and fetal membranes. For the beginner, it is somewhat difficult to find it at first month. So you can easily find these 2 signs by the 45 day of the gestation, or you can say if the animal is having the history of 1.5 month breeding. Okay, then you can look for these signs. If you are a beginner, you can find the amniotic vesicle by ultrasonography, because the amniotic vesicle at the very first month of gestation is just a pea size like. Okay, by the day 45 or 1.5 months, the amniotic vesicle is somewhat plum size, that is 3 to 4 centimeter, that one can easily palpate within the uterine horn. So what is the method? You just have to hold the uterine horn by the intercarnal ligament. Then you have to decide either you are going to check the left horn first or the right. We have to check both horns. Okay, if we have not palpated the amniotic vesicle in left horn, we have to look for the right horn. Okay, so what is the method? You have to hold the uterine horn very close to the intercarnal ligament. Okay, initially the amniotic vesicle will be here. So you have to hold the uterine horn in such a way you can grip, you can say easily by the attached border of the uterine horns with the broad ligament that is toward the mesometrium. And then you can hold the uterine horn in such a way your forefingers are just below the uterine horns and your thumb is just toward the you can say the clinician side. Clinician who is going to palpate it, the thumb will be toward the clinician side, or you can say this is the ventral surface of the uterine horn, this is the dorsal one. So dorsally you will hold by the help of your forefingers and ventrally by the help of your thumb, and then you will palpate delicately just like that. You will palpate delicately just like that. If there is some kind of the, you can say a vesicle that is filled with the fluid inside the uterus, you can feel it, plus you know that initially it is freely movable. Once you have palpated, you can just make a cup shape of your forefingers, and you can hold the uterine horn by the very attached border of the uterine horns in such a way the uterine wall will be free between your hands, and you can easily move in such a way to feel the movement of the freely movable amniotic vesicle. If it is not here, then we can perform similarly on the other uterine horn. Again, I am repeating it. You are just holding the uterine horn in such a way. You are tapping and you are searching for the amniotic vesicle. The pressure should be very delicate. Okay, and then you can look for the movement. It is freely movable or not. This was all about the palpation of the amniotic vesicle. Okay, then you can go for the palpation of the fetal membranes. So just you have to pinch the uterine horns between your forefingers and thumb in such a way by the entire, you can say, diameter of the uterine wall. You are not going to pinch just like that. No, you have to hold the complete uterine wall with the diameter, along the diameter. So you have to hold the uterine horn in such a way, and you are going to release slowly between your grip. You are going to release the uterine horn slowly between the grip of your forefingers and thumb in such a way. If there was, you can say, a fetal membrane, if there were fetal membranes, you will feel the slip movement of the fetal membranes within the lumen of the uterine wall if they are here. But right now these are not here, so you cannot feel it. So simply you can just feel that the uterine wall will slip from your hand without the feel of the membrane slip. Okay, and you can perform it on the both horn in similar pattern. Right? I'm just repeating it again. You are just holding in a pinch between your pinch of forefingers and thumb, and you're going to release the uterine horn slowly. Okay. Then we have to look for the placentons. For the placentons, you again have to hold the uterine horns in such a way, and then you have to rotate your thumb at multiple places. By some, you can say, a delicate pressure, you are going to rotate your thumb at multiple places. If there are some button-like round structures, it means that these are the placentons. Then if we are going to look for the fetus, it's very easy. You have to hold the uterine horns between your hand. Again, the pattern is similar. Every time we are going to hold the uterine horn between our forefingers and thumb. Okay, so you are just going to palpate the fetus with the help of your palm. So we have to put the pressure of the palm over here. So you can easily at multiple places you can look for the palpation of the fetus in the both horns. Okay, this was all about the 4 confirmatory sign. I'm just going to repeat it again. You have to just observe. Any one of you just have to name what kind of the sign I am looking for. Okay.
Membrane replacement.
Exactly. Okay.
Placenton.
Okay.
Amniotic vesicle.
And now
Fetus.
very good. Thank you.